Hi everyone, and welcome to my Facebook Live. Today we are going to talk about, I'm going to talk about one of my behavior cocktails. So I do a presentation primarily for veterinarians and veterinary staff and other pet professionals that I call the behavior cocktails. And a behavior cocktail is this blending of the medication to help, decrease anxiety, aggression, or compulsive problems. So the first go-to medication combined with an easy to follow behavior modification plan. So it's just kind of like thinking of the idea of like a cocktail as a drink. You have the alcohol and you have the fruit juice and other things, make it go down easy and you have a great product. That's the same concept here behind these behavior cocktails. Today's cocktail I'm going to talk about, I call it the Puppy Pina Colada. How many veterinarians out there or technicians have been asked by a client when that puppy reaches, especially about 4 months of age, do you have a doggy downer for this puppy or something like that? He's just so active. He's just, he was easy when he was 8 weeks of age or 12 weeks of age, and now he's just really like pestering and jumping up and over barking. Or maybe they're having house training problems. They're still having some house soiling. Or other things like that, naughty behaviors. So what I found through my general practice was I could intervene. I could have some interventional advice to give right away that would help to nip these problems in the bud or at least reduce them. And when it came to puppies, I just really found that if you follow these, I think there's three primary steps, these three things for all young dogs. So this includes dogs up to a year of age. We can really help these over rowdy, rambunctious dogs be much better, much improved in their behavior if we follow these three things. And then the alcohol part, if you want, the medication part for some of these puppies who are really rowdy or really scared and really anxious, then we add that in as well. All right, so the Puppy Pina Colada, and again, this is coming from my life experience blended with knowledge in behavior science, puppy development. Number 1, 3 minutes a day per pound of body weight of a walk. Not just time in the yard, not just going to doggy daycare. No, this puppy needs to be put on a leash, let out the door, and go around the neighborhood on a walk where they have this intermittent, they're walking, and getting a little brisk exercise, and then lead them to the bushes and lead them to the flower beds where they can sniff the dirt, sniff the bushes. They need to smell where other animals have urinated, other animals have defecated. And secondly, they also need to feel the different textures. They need to feel the mud. They need to feel the grass. They need to feel, the mulch around the plants. They need to feel the snow. They need to feel the ice. All of that is a part of that sensory development, tactile sensory development, which is very important in the development of the neurological system in the dog. This also basically wakes up the brain, all right? This is what enrichment is about. It's that engagement of the senses along with learning and activity. Many of our young dogs are not getting this level. And it's easy with the little toy breeds, a little 10-pound Yorkshire Terrier that's maybe 9 months old now. They got a 30 minutes of active walking per day. They're a lot more settled. Now, we don't want to do this in one walk. We actually want to divide this through the day. So especially for our larger breed dogs, because if you tell a client with a 50-pound, husky dog puppy, they now have to do 150 minutes of walking, they're just going to be like, no way, I'm not doing it. That's too much. I don't have the time. And that is true. One set chunk of 2 hours plus of walking, I don't know that I could do it. Yet, if we were to say, okay, this is our goal, and we want to break it up into 4 or 5 walks a day, so could you do 4 20-minute walks, 5 20-minute walks? That would bring us a lot closer to that 150-minute desire. And when people get in the habit or get in their own routine of 20 minutes, they can make it 25 minutes. And then they'll get up closer to that number. But the yard, people might have been shocked in my office when I would say to them, your backyard is solitary confinement. it does have space. He does run around and he sniffs around, but it's too limited. It would be just the same as you being stuck in one cubicle at work. And I think some people are experiencing this at home right now in the pandemic, like, oh, I'm at home all the time. I need to get out. I need to not just see people, but I just need to like walk in different areas, etc. The same is true for our animals. So a minimum of 3 minutes walking on leash per pound of body weight per day. So, yeah, that's going to lead us into puppy class and training these puppies how to walk on leash. But that right there, number 1. 4 on the floor. I have a video on my YouTube channel. It's called Stop Jumping Up. And I refer to the 4 on the floor. I also cover this in my Better Bond, Better Behavior Puppy Behavior Consultant Certification course. So 4 on the floor means the only time this dog, this puppy, is touched, looked at, or talked to by everyone in the home, everyone this puppy encounters, is when all 4 paws are on the floor. As soon as that puppy goes to jump up, the owner has to take a big step back such that the puppy will not touch their body. And as soon as those 4 paws hit the floor, that's where you can say, good dog, and give them a quick reward, or even then pet them, or then release the ball for play. And if we are firm on this, the only time you're getting anything good in life is when all 4 paws are on the floor. It really decreases all that jumping up, the impulsive behaviors, the nipping and the grabbing at the elbows and the sleeves and the arms. And, even if they're doing a lot of butt wiggling and a little bit of body slamming around you, that is more tolerable than, especially in these larger breed young dogs that are literally jumping on people, knocking them down, scratching them, and it also decreases a lot of that arousal to what becomes that nipping, biting, impulsive behavior. Okay, so 4 on the floor. And if you're in a veterinary practice, if you're a dog trainer, if you're at a shelter, you do this as well. Follow this yourself in your office, and don't be lulled by the cute little puppy that starts jumping up on your legs and you go, oh, hi, and you pet it, because then you just broke that 4 on the floor rule. And if you want to help them need to be in better control for their veterinary exams, and to set this dog come from the shelter or rescue up to be less impulsive in the new home, all of us have to be following this 4 on the floor as well whenever we are around any animals. All right, the last one. Following my 5 simple rules for potty training. I have a handout. It's included with my Better Behavior, Better Bond Puppy Consultant course. And it is also included with the Housebound Puppy Socialization course, my online, puppy training class, because a lot of people can't get to puppy training class. All right, so the 5 simple rules for potty training. Number 1 is we do not leave food out. We're going to use actually a lot of that learn to earn twice a day, so we're getting the puppy on a feeding schedule. The bowels are stimulated to contract typically within 20 to 30 minutes after eating. If the puppy's on a twice a day feeding schedule, whether you are just feeding them or using the learn to earn, but more in this time frame, like 1 hour in the morning, 1 hour in the evening, now we can predict when the puppy's going to need to go out and go to the bathroom. Life becomes predictable. Okay. The second one is you have to use a leash, even if you have a fenced-in yard. And the reason is when the puppy sees you get the leash, now we have that whole ritual of coming to the door, and clipping the leash on, having them wait for a second. And when you take that puppy out on the leash and the puppy is sniffing around and is immediately after they've passed their urine or stool, the human's attached to that puppy. So they see the puppy do this, and as soon as the puppy stands up, that's when you say, what a good dog, and you give them the reward there, outside. So the third step is all rewards for elimination are outside, none inside. So often the client gives them the reward, oh, I forgot it, okay, we'll go inside, oh, here's a treat, when the puppy comes inside. And what the puppy's learning is, I'm a good dog for coming inside. So the puppy may go out, maybe urinate, because that's, the easiest to pass and kind of causing the most discomfort for the puppy. And urination then is a relief of the discomfort. But they urinate enough to kind of take the pressure off. And then they're like, oh yeah, I want to go back in the house because I want to get my treat. And when they go back in the house and they get their treat, Then 20 minutes later, 10 minutes later, I still have to go to the bathroom again, so they find that spot where they went before and they have another accident. And every accident just reinforces that's the place to go in the house. So all rewards need to go outside. Now if the puppy has not, say you walked him around, he urinated, and you're anticipating that he is going to need to have a bowel movement and he hasn't done it yet, and you're like, well, I just need to get inside. I need to make my coffee, I need to get my day started. We're going to take the puppy inside and we're going to tether or tie up the puppy to a piece of furniture somewhere that the dog stays in the room you are in. That the puppy does not have freedom to roam around the house. And we are going to give that puppy 10 or 15 minutes, because in that time frame, the puppy now is going to want to urinate or defecate, and typically they're going to start pulling at the leash to try to get to that old toilet area, or they may start to, circle, and you can tell, like, I think you need to go out. All right, you take the puppy out, and you repeat those first 4 steps, and now when the puppy has eliminated outside, you give them a lot of reward outside and a lot of praise outside, okay? So those are the 5 simple rules for puppy potty training. And honestly, even in 1-year-old dogs who've really had a lot of problem with this, my 5th step is we're going to keep the puppy in the room that you're in and reliably take them out, okay, when they're not getting full roam of the house. Anyway, even a dog who's 1 year of age, we've been having a lot of toileting problems, and we have screened for health problems like worms or digestive disorders or urinary tract infections, or overly dilute urine. If this dog has been drinking too much water, they can actually wash out the ability for the kidney to concentrate the urine, and so that may be a part of why they're urinating. But let's say we know none of those medical issues are at hand here. It's been a training and consistency problem. Go back to these 5 simple rules for puppy potty training, and I have seen dogs at 9, 10 months of age who were very difficult to house train. They trained up when these were followed. Now, if the client is saying, and the owner's saying, oh, I'm still having toileting problems, then, just go down that 5 list. Are you taking them outside on a leash every time? I'm trying to means no, I'm not. Okay? I am. Yes, they are. So we have to also listen carefully to what the client is saying, and we have to press this to a very much of a yes/no, because oftentimes you're going to find one of those rules is not being followed, and that's why you're having trouble with the house training. Okay, so we do this part. This is like our coconut milk and pineapple juice and the pina colada, but we have a puppy who is too scared to walk on a leash. He's sitting down, he's pulling back, he's barking and circling and very anxious when he's on leash if he will go on a walk. Or let's say he gets outside to eliminate and he just cannot get focus at all. He wants to chase and bark at every little leaf that blows by, etc. So we have more than a training behavior modification problem here. We have a puppy who is either too highly anxious and needs help to reduce that mental anxiety so they can focus and learn. We may have some genetic problems, meaning their temperament is genetically more wired to be very easy to go up to barking, easy to chasing. Yet at this young of an age, we can intervene and get better mental health in these young dogs so they become better dogs by going to the correct supplement for the puppy, the diet. Really important, what food is this puppy eating? I really don't want to hear about the raw diets on these puppies. We want to feed the food that your veterinarian recommends according to the life stage of your puppy. And if your puppy has any kind of food allergy or any kind of other, intestinal upset, that we have the diet that helps to get the most calm, regular 2 firm bowel movements a day in that puppy. And we don't keep switching diets around. Okay, so diet's important. And then lastly, parasite control. Many puppies are born with roundworms. You won't always see them in the stool. And it may require 3 wormings or maybe even 4 dewormings over the scope of the first year of that puppy's life to truly be clear of any and all roundworm, hookworm, whipworm, tapeworm, giardia, or coccidia. Okay, so if you've recently purchased a puppy, or again, we don't want to rely just on, oh, he has a heartworm preventative and that'll help prevent everything. It depends on which brand he's on, you know. HeartGuard Plus is protected from hook and roundworm, but not the tape and not the whip. Also, too, remember that the emergence in the GI tract of some of the whipworm and tapeworm may not show up until the puppy is 4 or 5 months of age. And these parasites will interfere with how well they can absorb the nutrients they need for important brain chemistry, for calming, and for good learning, okay? So supplement, diet, and parasite. Now, this is coming definitely from your veterinary professional, your veterinarian, for advising for this. The last one, really about all puppies will benefit from the use of Adaptil spray or Adaptil collars. Now, I really like the spray and collars more than the plug-ins, and the reason for that is, remember how Adaptil works. The mother dog calming pheromone must be inhaled through the roof of the mouth. And if this puppy is going out on a walk, we need the pheromone to go with the puppy out on the walk. The plug-in is sitting back at home in the living room. It's not going to help that puppy on the walk. So we want the collar, because the collar has the pheromone embedded in the collar, and the body heat gets it to evaporate and be treating the puppy all 24/7 for a month, and the client doesn't have to remember to keep reapplying it. Okay, that's another real big advantage of it. The sprays can work well, but they will need to be put on something like a bandana, and we put that on the puppy and wait maybe 5 or 10 minutes before we go out on the walk, before we go to puppy class, before we go on some of these socialization steps, you know, and things that we want or need to do. So Adaptil is available across the counter. You can buy it at the pet store. You can get it anywhere. It does not require a prescription. Many of our veterinary practices are carrying it. I strongly advise for every puppy veterinary checkup and exam, and at the shelters. When you are doing your vaccination clinics or even just intake and shelter, use the Adaptil, especially around these puppies. They really need it, and it will help facilitate them to learn to accept handling, because that handling is really important. Okay, so that's that Puppy Pina Colada. 3 minutes of walking per pound of puppy a day divided. 4 on the floor. Practice 4 on the floor for all greeting, all interaction with that dog by everybody. And then follow the 5 simple rules for puppy potty training. We have a slightly fearful puppy, a puppy who's not responding so well, immediately go to what your veterinary recommends for the supplement, diet, and parasite control, and then use Adaptil spray or Adaptil collar. We're coming into this year now of this puppy pandemic, post-puppy pandemic stage. You know, I myself am seeing a lot of and getting requests for consults for dogs who are 9 or 10 months old because they miss socialization class and just a lot of other ways to help them, you know, learn how to be a better dog. And so I have a puppy behavior consultant course. It's called the Better Bond, Better Behavior Puppy Behavior Consultant course. It is available online through my website. You can go to the shop. Now, Illinois, where I live right now, we have now moved into the Tier 1. And we can have a small gathering. So watch my website, watch my Facebook page. I am looking at doing a day puppy workshop, young dog workshop, and I'm going to call it the Pandemic Puppy Workshop. I'm going to add content for how we can help these 9 and 10-month-old dogs that really got off to kind of a poor start, to decrease that 73% of new dog owners considering surrender. Some of the things that are included in the course, of course, a lot of it's all online, but you will also receive the instructor's guidebook that I've written that has syllabuses for puppy consults that you can do to intervene with the behavior, as well as a syllabus for classes. It does include a textbook, Dr. Sophia Yin's 7 Days to the Perfect Puppy, and a full year of support from myself for any puppy cases that you have. Well, I hope everyone has a good day. Thank you very much for attending. Remember to go to my YouTube channel and subscribe there. I will be uploading these Facebook Lives there. And you can always reach me through my website at drsallyjfoote.com. Thank you very much. Bye-bye.